This is not the correct mask. Of course, this is just, a nose mask. But in the hospital, we do have what we call a collar mask. I don't know if anyone's seen a person with a trach before, but it looks more like a bowl, and it actually fits, it covers better than, using this. But we don't have one, so we're going to pretend. Because remember, like with nasopharyngeal suctioning, if we're going to be concerned about any period of time of them being without oxygen or them becoming, hypoventilated at any point, then we need to hyperoxygenate them. So we're going to pretend that we're going to use this as our the correct mask. So what would determine that my patient's trach needs to be changed? What are some things that would make me want to change the trach? Because is there going to be an order to change their trach daily? It's going to say change as needed. So as the nurse, how are we going to know when that needs to be changed?
If your dressing looks dirty.
Okay, and sometimes it may be that the dressing itself just needs to be changed, but the trach may not.
It's
So
clogged.
it's clogged, and a lot of times it'll cake up with mucus, okay? And so on inspection, we would see that there would be some crusting around the trach site, and so that might let us know that it's a good time. And also sometimes it may be just suctioning if we hear a little gurgling that they need, but also noise, that gurgling noise may also alert us that it's time to change the trach. Okay, so what we would want to do is, of course, once we enter the patient's room, wash your hand, do proper hand hygiene, inform the patient about what we're doing. If they've had this trach for any period of time, then they're going to know what to expect. But if not, then we may need to educate them about, the proper way of doing trach care. This patient's trach has this. Does anyone know what this is for? Okay. Inflated. Some of the trachs are cuffed, and some of them are not cuffed. Does anyone know why we would use a cuffed versus an uncuffed trach? Okay, if a patient's needs ventilation, a lot of times, if they are going to have ventilation, then the tube needs to be cuffed, because the cuffed allows balloon. It's like a balloon at the end of the cuff, kind of like the Foley. So when we insert air into here, it occludes the whole airway. So no air is allowed to pass on the sides of the cuffed. If it's would that person be allowed to cough through that or speak through that? No. And so an uncuffed trach tube is what we use if it's going to be for a permanent trach. So if they're going to have it for a longer period of time, and they're not going to be need assistance with ventilation, so they're not on a vent, then a lot of times we'll put in a non-cuffed trach. And that does not have this little device here, so you wouldn't see that. So that's why I wanted to explain why this is here, why you'll see it on some patients, and you won't see this on some trachs, because it determines whether or not it's cuffed or uncuffed. Sometimes a little port that goes down into the trach is disposable, and sometimes it's not. So you would also need to know, is this a disposable inner cannula or not? And if it is disposable, then we can just trash that. We don't have to worry about cleaning it, and then reinserting that one, we can get a whole new replacement for the inner cannula. So we also need to know that before we go in to do the trach care, whether or not this is a disposable inner cannula, or is this non-disposable, and we need to clean it and replace it with the exact one that's there. So those are some things that we kind of need to know before we go in to do trach care.
How do you know if does it have like on charting?
A lot of times the ones that are non-disposable or metal, okay, and so you'd go in and it would be a metal inner cannula, whereas the disposable ones are plastic. And that's typically how I've always done in the past, knowing if it is. But okay, so any other questions so far? Okay, so we've done hand hygiene. We are now oxygenating our patient. We would want to put, what else would we want to add to our patient? Pulse ox, okay. And why would we need to know a pulse ox? Monitoring O2, and it also a lot of times will let us know heart rate. Remember when we did nasopharyngeal suctioning and we talked about the deviation in the pulse rate, that might be an indicator that we need to stop for a moment? We would want to observe the same things. We would want to watch our patient closely to see how well they're tolerating this procedure and whether or not we need to stop and give them a break, or we need to continue.
Is that 20 beats over?
20 beats above or 20 beats below that we would want to stop and kind of give them a break before we continue on. Okay, so the first thing we're going to need to do, again, is hand hygiene. I'm going to go ahead and place a towel going to move my patient to a comfortable height for me. And I'm going to put a drape over.
And my hand got you get the kudos for the day because I forgot hand.
Oh.
I'm a slacker.
Well, yeah, that's just because you made me read the thing that okay, and one of the things I always do when I do trach care is I do wear a face shield. I don't know if and I'm sorry, my phone keeps going off. I have students in the clinical area today, so that makes me nervous, so I'm sorry if that's doing that. But I don't know if I've ever told y'all, but I did home health for a little bit when I was going back for my bachelor's degree, and I was taking care of a 8-year-old who had a trach. And when I would go to do trach care, and even when I wasn't doing trach care, when he would be aggravated with, not being able to do what he wanted to do, he would spit at us through that trach, okay? And so, and it was always phlegm. It wasn't, yuck. And so, you can get exposure doing trach care, so it's very important. And even with glasses, I still like to use the face shield because it covers more, and so you would want to use a face shield. Okay, so we're going to pretend I have it on because I can't talk to y'all through that, but you want to practice putting with your face shield to protect yourself, because this is one of the times that if he begins to cough during the dressing change, I'm not going to be able to block myself in order to make sure that I don't get exposure. So we've done hand hygiene. I'm putting on old gloves, or just clean gloves, not sterile. And I've assessed my patient, determined my patient needs this procedure, and that my patient is stable at this time to do it. Okay, and so I would go ahead and remove the mask and set it to the side. And I like to go ahead at this time with dirty gloves, and I like to, this thing isn't always easy, because with 2 hands, in a minute when I want to keep one hand sterile, I'm not going to be able to manipulate this, so sometimes it's hard to get out. So I like to go ahead and at least loosen it in a way so I can get it out in a minute with one hand, and even with gloves sometimes. So there's just this little clamp that you got to get a hold of to make it come out.
They're getting all the gossip that.
Okay. So I just loosen that enough.
They're blowing over.
Wait, they're at Good Shepherd?
Oh, they can do all that? Okay. I'm sorry. I have four of them. One's at Trim and Smith, and it's our first day to ever do trimming, so I'm nervous. So I have.
And some are there at Good Shepherd.
Okay. And so what I would do is just loosen it, so in a minute I'm able to remove it with just one hand. Okay. And so I want to go ahead and remove the oil dressing. And when I remove my oil dressing, what am I going to be doing?
You want to know the color and how much.
Right. I'm going to go ahead and I'm also going to move the gown enough that I can see really well. I'm going to look at the skin integrity, as Drew was saying, underneath that. Look what kind of drainage I have before I start cleaning it. So just do a really good, thorough inspection of the trach side. Okay. So then I'm going to go ahead and remove my oil gloves. Do hand hygiene again. And of course we have normal saline at the bedside as well. Same thing, if it's a reuse, if I've used this before, I need to check the date and all that. If it's new, again, I would want to date it and time it. Go ahead and loosen my saline. And now I'm going to open my tray. And on the top, this is just like when you open yours, it'll be just like this. So my first glove. Why did I go ahead and loosen the saline?
So that you wouldn't break your sterile.
Right, because in a minute I don't want to have to use 2 hands to do that. And inside here you're going to have a dressing. Okay, and then you're going to have here's the tie that she was talking about. So you want to set that aside if you're not going to use that. Your pipe cleaner. And this is going to be our new cuff that we're going to use in just a minute. And then my 4x4s to dry with. Okay. And then I'm gonna keep my dominant hand clean. And then I would take this around here. I want to pour actually 2 containers, or water saline into 2 containers. One to allow my trach to soak it. And then I want one to use for my Q-tips. So when coming back over here, okay, and I'm going to use my my dirty hand now just to remove this, only touching the very outer part, because I've loosened it, right? So I can get it out. And then I'm going to drop it, okay, into my clean saline. Now I'm going to get a Q-tip, dampen it, come back, and I'm going to clean around the trach, okay, in a circular motion, and then discard. And then I'm going to get another clean up underneath the trach, okay, and if I need to, I can hold this and clean around. Okay, and then discard. Now I'm going to get my and again, the longer it sits in here, the more it's going to actually clean the, because if that stuff is caked on there, it needs to soak for a little bit, or it's going to be even harder to get off. Okay.
So you just use the pipe cleaner to clean that?
Right, and I'm just kind of giving you like you would want it. And then, again, this is my contaminated hand, so what part of this do I want to make sure stays sterile? This part in there. So then you can get your pipe cleaner, okay, and you want to clean down in it, which I just contaminated my fingers. Okay. And if you need to, get back in there. I think I just messed up. Okay. And then you're going to want to rinse it. Now, Jennifer, I just messed up. Okay.
That's okay.
I'm just trying to think. Okay. Then you want to get your pipe cleaner and then go down and dry it. Why is it important that we dry the inside?
So fluid doesn't get down.
Yeah, so that when we go in a minute and we put this back in here, then it is dry, okay? And you also want to get one of your 4x4s and then dry the outside as well. Okay, and then we go back in. You want to turn it to when it turns to the side to insert, and then back in, and then push it to locks. Okay, then you're going to need to get your 4x4. Okay, and then holding it in place, you want to dry up underneath the skin. And then discard. And then you're going to get your new cuff, and you're going to want to slide it underneath your patient's trach. Up and under here. Okay, and then you'll want to get your new cuff. And we do not remove our old one until we get the new one in place. So you attach on this side, feed it through. And Velcro it. And slide it under. Why would I I want to make sure that I keep the old one on while I'm changing the new one.
So that it
Keep it in
doesn't
place.
come out when-
Right, so I keep it stabilized while I'm changing it. And then, I can remove the old one. Okay, and then I would want to reattach my oxygen, reassess my patient to see how they're doing after the dressing change, like this, and see how they tolerated that.